Hi everybody, welcome to day 2, tissue valve options in aortic valve stenosis. Now yesterday we talked about mechanical valves. Here's a mechanical valve, the clicking valve that will last forever, but you need a blood thinner called warfarin, a tablet you take every day to prevent clot formation on the valve. You need that blood thinner for the rest of your life, there are no other options. Brilliant solution for young people who need a solution that will last them a lifetime. Now in older people, or in patients who just cannot or do not want to take warfarin, there is another option, and it's called a tissue valve. This is the porcine tissue valve made out of pig tissue sewn onto a man-made sewing ring that we can stitch into the aorta pipe. The tissue valves can actually be made out of cow's tissue as well, and they are called bovine valves. Porcine valves, bovine valves, pigs or cows, they're pretty much the same thing. The bottom line with tissue valves is that they don't need warfarin, but the drawback is that they can wear and tear. Now, if you were the age of 70 and I could take 100 of you, exactly the same, then 10 years later, 85 of you would have a tissue valve that still worked perfectly fine. 15 of you would require further treatment because the tissue valve has worn away and either become rigid and not opened properly or become regurgitant, it leaks. Either way, it would need to be reoperated on in some manner. Now, reoperation doesn't necessarily these days mean open surgery, and we'll talk more about that when we talk about TAVI tomorrow. The thing I want you to remember about tissue valves is that they don't necessarily last forever. So if you're 40 years of age and you don't want to avoid warfarin, that's absolutely fine. The problem is these tissue valves will wear and tear very quickly. So in a man of 40, we wouldn't expect 15% chance that it's failed at 10 years. It would be more like 50% chance. Now, what can we do about that? Well, there are other solutions for you. One solution, if you just need an aortic valve replacement, is to consider a valve that may have a slightly longer durability than the traditional pigs or cows valves. There is a new valve called the Resilia Inspiris valve. Now, a lot of you will have heard about this valve already. Just to give you the lowdown on this valve, it's pretty much the same as this tissue valve. The only difference is the leaflets are made up of cow's tissue that has been treated in a different way to the usual pigs or cows valve. It's been treated in such a manner that when we experiment with that valve in the lab, it seems to last 4 times longer than the traditional cows or pigs valve. So we're expecting it to have a very long-term durability in human beings also. The only drawback is we don't really know the answer, but we know out to about 6 to 7 years. And so far we're seeing that the Resilia valve does not seem to wear and tear. So in younger patients who really do not want to take warfarin or who cannot take warfarin, then the Resilia valve may be the option. Now, there is another type of tissue valve called the sutureless valve. Now, I mention this only to complete this conversation. Some of you may have heard of the sutureless valve, some of you may not have. Now, what is a sutureless valve? Well, there are different types. The one that we prefer to use at the Keyhole Heart Clinic is the Intuity Elite Sutureless valve, which is pretty similar to this valve that I'm showing you now. The only difference is that this sewing ring is made in such a manner that there is a cuff that we can blow up with the balloon to secure the valve into position, so we don't have to stitch it into place. And the beauty of the Intuity Elite Sutureless valve and other sutureless valves is that they can reduce the time it takes to implant a valve. And this is very useful in older people who need a short operation time, and also extremely useful when we do keyhole heart surgery. In all honesty, all of the valves that we're going to mention to you can be performed via keyhole heart surgery, but the Intuity Elite sutureless valve and other sutureless valves really lend themselves to a very quick deployment. So in summary, tissue valves are valves that won't necessarily last forever, much better used in older people, but the beauty is they don't need warfarin. So perfectly ideal for the older individual who should avoid warfarin, or in those patients in whom warfarin is contraindicated. In those patients who are younger, who really don't want to take warfarin, then the Resilia valve may be a solution because it seems to demonstrate longer term durability than the traditional tissue valves. Now, of course, you might say, well, why don't we put the Resilia valve in everybody? The simple answer to that is that because we don't know what it's like to 15 or 20 years, there is a risk you take in accepting the Resilia valve, and that is that we won't really know how good it lasts out to 10 or 15 years until we see the data in human beings. But so far, the data in human beings seems very promising. Now, that's a really short video today because much of what we talked about yesterday is relevant to today. Tomorrow, we're going to talk about transcatheter aortic valve implantation, a very exciting new way to replace the aortic valve in aortic stenosis, where we don't have to do an operation, we may not even need to give an anesthetic, and we can pass this valve through the groin on a wire and into position without the need for open or keyhole heart surgery